Hey, nurses, travelers, night shifters, and heroes. Welcome back to the TradNurse podcast. This is episode 7. I'm Christine, your host, RN by night, podcaster, and even day trader by day. Last Tuesday, November 12th, something interesting happened. Over 500 nurses in scrubs and business casual descended on Washington. This wasn't a protest. It was the American Nurses Association National Nurses Day of Action. And I need 18 minutes of your life, your time, to tell you why this is the most bullish thing that's happened to nursing in years. If you were on nursing Twitter, X, last week, your timeline was flooded by hashtag Nurses Day of Action. Nurses left stethoscopes on congressional desks like we were dropping mics on the entire healthcare system. This is symbolism on 100. Here's the quick TLDR. That is an acronym for too long, don't read. Don't worry, I will summarize it all for you. 500 plus nurses, representing 47 states plus territories, 244 House meetings, and 92 Senate meetings, all in one day. We pushed 2 big bills through, the SAVE Act for workplace violence prevention and the authorization of the Dr. Lorna Breen, BREEN Act for mental health funding. And before you roll your eyes and say lobbying doesn't work, let me hit you with some cold, hard numbers that even a financial analyst would respect. The violence statistics that should scare every hospital CFO. Healthcare workers get assaulted at 6 times the rate of any other industry. 6 times. 81.6% of nurses experienced at least one type of violence in the past year. Verbal abuse, 67.8%. Physical threats, almost 40%. Getting pinched, scratched, punched, bit, and spit on, 37.3%. Press Ganey counted 16,975 documented assaults on nursing staff in 2023 alone. That's a 5% increase year over year. And let me put that into trader speak. That's a 5 sigma event happening every single shift in some places. And new grads, you poor beautiful souls with less than 2 years of experience, you are 1.8 times more likely to take a fist because you haven't learned the de-escalation tactics yet. Every assault costs the hospital between $27,000 and $105,000. When you factor in turnover, workers' compensation, and legal fees. Multiply that by 17,000 and suddenly hospital administrators care. Funny how money talks, louder than blood. Burnout, the silent factor that's bleeding us out. It's a layer on top of the assault. In a brand new 2025 Umbrella Review, that's a meta-analysis study of meta-analyses, they found emotional exhaustion rates in hospital nurses that are straight up depression level in some countries. In the United States, we're looking at a projected shortage of 200K to 450K. That's 450,000 nurses by the end of the year. Turnover cost, 1.5 times 2 times the annual salary per nurse who walks away. That's real money. So when 500 nurses show up on the Hill and say, fix this or we are leaving, Congress suddenly finds an interest. The 2 bills that could actually move the needle are Bill number 1, the SAVE Act. This creates federally enforceable OSHA-level workplace violence prevention standards. Translation: hospitals have to write a real plan, train staff, track incidents, and actually be held accountable. No more just thoughts and prayers, posters in the break room, incident reports that take overtime hours for a nurse to fill out and nothing gets done. Bill number 2, Dr. Lorna Breen Healthcare Provider Protection Reauthorization Act. If you don't know what this is, a New York ER physician took her own life amid COVID burnout. So this bill extends mental health programming and boosts nursing workforce development for healthcare workers and extends nursing workforce funding through 2030. Named after the ER doc who took her life in 2020 because the stigma was worse than the burnout. These aren't pie in the sky bills. They are bipartisan, they are moving, and they have momentum because nurses showed up in person. The TradNurse arbitrage angle, and you know this was coming. This is how I look at statistics. Here's where it gets real for the listeners. Violence plus burnout equals mass exodus. And that leads to a supply-demand imbalance, which leads to traveler and per diem rates stupid high for the foreseeable future. And I'm not saying root for chaos, but if Congress drags its feet, the traveler market is going to keep printing money like 2021 and 2022. We saw nurses making $150 an hour. And I've got friends still clearing 8 to 10K a week in the Northeast because no one wants to take the staff jobs where they might get punched on a night shift. Ironically, the worse the crisis gets, the more leverage we have, both at the ballot box and at the negotiation table. Personal stories from the Hill, the part that actually matters. And I want to read you 2 quick stories that were shared on the Quorum platform last week. An ED nurse from the Pacific Northwest. Quotes, last month a patient high on meth punched me so hard my orbital fractured. Hospital response, question mark. Fill out an incident report and here's a $5 cafeteria voucher. I'm out, submitted my resignation the next day, end quote. Story number 2, ICU float large academic center. Quote, I've had PTSD symptoms for 18 months. When I asked for EAP is Employee Assistance Program, HR said we don't have the bandwidth right now. I'm a single mom. I can't just quit. So I cry in the medroom between vent checks, end quote. These aren't just fringe cases. There are plenty of these testimonies. And that's why 500 nurses left stethoscopes on the desks of congressional members. Because sometimes you have to make them literally hear your heartbeat before they'll protect it. So what are we going to do about this? Here's your marching orders. What to do this week. It'll take you less than 5 minutes. Go to rnaction.org. Type in your zip code, send the pre-written letter supporting the SAVE Act and the Lorna Breen Reauthorization Act to your representatives. Bonus points. Record a 15-second video telling your own story and tag hashtag Nurses Day of Action and hashtag TradNurse. Every single message that lands in a congressional inbox gets tallied. We are already over 20,000 messages since last Tuesday, which was November 12th. Let's make it 50,000 by Thanksgiving. Look, I've been a nurse and a trader. Both professions have taught me the same lesson. Markets and systems only change when the pain of staying the same becomes greater than the pain of change. November 12th was us nurses turning up the pain dial on Congress. We are not asking for special treatment. We are asking for the same basic safety precautions that a construction worker or a factory employee already get under OSHA. If we keep showing up in person, online, at the ballot box, 2026 is going to look very different. So stay salty, 5,000 milligrams of sodium salty. Keep logging those electrolytes. Protect your capital, financial and emotional. And never forget, nurses are the power. Drop your own workplace violence or burnout story in the comments or DM me at TradNurse on X. I read every single one. Until next week, hold on to those stethoscopes, chart hard, be strong, and take care of the greatest asset you'll ever own. And that is you. God bless.